Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, listeners. It's Lindsay Smith-Rogers. Innocent Grant is a family planning advocate from Tanzania who's made it his life's mission to protect women and girls and to ensure they have the tools to make informed decisions about family planning. He's currently an MSPH student at the Johns Hopkins Bloomberg School of Public Health. And today he talks to Stephanie Desmon about what proposed family planning funding cuts could mean to the health and well-being of people in his country and around the world. Let's listen.
Innocent Grant, thanks so much for joining me.
Thank you.
So today I want to get your perspective on the state of family planning, given the threatened cuts from the new administration. And I guess I want to start by telling a little bit about your story. You have done a lot of work in family planning with young people in Tanzania, your home country. And I'm wondering how you got involved in this and what is the situation going on?
Yeah, thank you so much, Stephanie, for that question. And as you mentioned, I think what is current happening at the moment, it's quite shocking for me. And it's also very personal because a lot of people in Tanzania are asking me, why are you, as a young man, working in family planning? I want to say the truth. I grew up having a dream of becoming a doctor. And I really wanted to be a doctor, treating people, because where I grew up in the southern highlands of Tanzania, I saw people, especially during the, high prevalence of HIV infection, I saw people getting sick and I knew how it's painful to be sick. So I wanted to be a doctor. And then I went to do my clinical medicine studies in the southern coast of Tanzania, region called Mtwara. When I was doing my studies, one of the things that you do as a young clinical medicine student, you're being placed in different wards for practice. One of the wards that I was being placed for my practice was the obstetrics and gynecological ward. If you go to Mtwara today, I'm sure, and you walk into that ward, you must find cases of very young adolescents, girls and young women who are suffering serious complications of a safe abortion. And one, it's because access to safe abortion in Tanzania, it's illegal. Two, it's because access to sexual and reproductive health information and family planning education is very limited. And it's very limited because of the cultural perspective of people. A lot of people still believe that teaching young people about family planning or sexual and reproductive health is actually motivating them to do sex, which is not true. But it's actually to make sure that they are making informed decisions to be able to improve their sexual and social lives in the country. So when I met these cases, I started volunteering myself for a sexual health club, which was based in my school, going to the communities, sparking dialogues around sexual and reproductive health and rights, and responding to the question that the communities had. And it was easy because we were like a very trusted institution within the region. It's a medical institution within the region. And we are like young doctors, very, very inspired to respond to the question. And I felt like I was helping someone every day. I responded to those questions that I couldn't see them in the gyna ward where I met cases every day. So after I graduated my studies, I decided to keep on working in the field that I was working. So I joined an organization called Young and Alive Initiative in Tanzania, and we kept doing the work that we were doing back from school to this organization, making sure that we promote sexual and reproductive health information to populations in Tanzania through different programs that we implemented. And I think we've met quite good achievements from that time. You would see, like in countries like Tanzania, I think maternal mortality rate dropped from 556 per every 100 live births, 100,000 live births, to 116 today as we are speaking, per every 100,000 live births. And when they look on these outcomes, they proudly attribute it to family planning programs and interventions that we have going on in the country. So I would say it's a good progress. I'm really proud to be part of that work.
So the current threats of cuts, they must concern you.
Very, very. It's really sad. We were just coming from one of the events called the Future Family Planning event, where different practitioners who are working in the field of family planning were meeting up to discuss what's the way forward, how are we going to respond to the current situation. And looks like almost 70% of the family planning funding have been cut globally here in the United States, but also in different countries And as I said, it's of concerning to me because I keep remembering cases of people I met in the hospital, but also I keep remembering people I've worked in Tanzania. I normally give this example. At some point in Tanzania, I was working with a group of young mothers. These are young mothers who dropped from school because of being pregnant. At that time in Tanzania, when a girl gets pregnant, they're not allowed to go back to school. So they had a child to support, at the same time, a burden of no qualification to gain a good job. And it's because access to family planning, sexual reproductive health information was also very limited to these groups of people. Now, see, they're young people, they have young kids as well, so they're young mothers. They have poor motherhood skills, exposing their children to poor nutrition. They are doing sex to get money because they're just home by the time I was working with them. And they do earn even less than $5 per day for the work that they do. And, their children are also exposed to the same kind of poverty situation that they're also in at the moment. Family planning programs, family planning work was actually going and meet these groups of people to make sure that they're informed. And we had made a very good progress. Nowadays, family planning programs were not just about family planning. They had integration of other important components like economic empowerment for these groups of young mothers, climate justice for people in different areas. All of a sudden, these interventions have been demonized. These interventions have been cut. So you expect those cases of people who are suffering unsafe abortion coming back again. You expect these groups of young mothers that I just met in Tanzania to go back into the same cycle of problems that they were in again. It's quite terrifying. It's about improving people, improving the lives of these people, and improving their economic well-being and the well-being of their children, and for the future as well. This is worrying, and I hope whoever are doing these decisions and researchers and group of advocates can keep speaking up the value of family planning work to make sure that we don't cut funding investment in the field of family planning, because the outcomes of investment in family planning are for lifetime achievements.
So I assume that some of your work is really shifting norms about family planning and reproductive health. Do you worry about backsliding there?
I am really concerned about that. This morning, I just joined a webinar with the World Health Organization around addressing misinformation and disinformation in family planning. And we see this as a public health crisis. And I was giving an example at some point back in 2023. I was invited to a BBC interview, which I thought was an interview, BBC Swahili interview. But when I went to this interview, it wasn't an interview, it was a debate. And I was placed against one of the head of a very big and influential civil society organization based in Kenya, who claimed that family planning education is actually harmful for sexually active adolescents and young adults, and claimed that it's doing more harm than good. And I was pressed there. And I remember that interview went viral because I just responded very calm, saying, what's a bad thing about sexually active young people doing sex if they're actually informed and they make responsible choices when they're engaging in their sexual and social relationships? And I remember emphasizing the importance of pushing for evidence and facts when we are delivering this information. And I also shared about an example of the intervention I used to run internet, the contraceptive conversation. This was a Q&A platform where people just asking questions. You'll be surprised by the nature of those questions. They're questions that may seem very simple. For instance, I remember some of these questions is, can I use a condom twice? If we don't respond to that question, someone may ask somewhere and they would be given an information based on fear and information which is also wrong and full of stigma. Questions like, can an implant, the contraceptive implant, the one that is used to be inserted within the women's upper arm, can it travel to the heart? These are questions we're receiving within this platform. Questions around, do contraceptive pills feel in the stomach? These are questions that we do receive from the communities. When we don't have interventions that are actually responding to these questions, people who are doing misinformations for the purpose of misinforming might respond to those questions with fear and stigma and giving wrong information. And we're going back to have a lot of cases of unsafe abortion complication. We'll be back to have a lot of cases of young mothers and young fathers today who have got poor parenting skills, exposing their children to poor nutrition, poor childhood development. Same poverty cycle is what we're talking about. We really have to work in addressing these misinformation, disinformation, and challenging harmful norms that are actually hindering our progress within the field of family planning, sexual and reproductive health.
So, given the situation, what do you think can still be accomplished in family planning here and abroad?
Yeah, I'm really grateful first that I'm doing my master's now within the Johns Hopkins Bloomberg School of Public Health, which I think is I say for myself, but for many future public health practitioners to not be worried about the future of public health in general. Keep doing investment for young professionals to come and do their studies and strengthening their skills. This really helps in bringing the future of new scientists, people who are going to work in public health, people who are going to contribute to the new body of knowledge and evidence that family planning works, that family planning matters. It's about improving people's lives and improving people's dignity. And the more evidence we have, the more we're building the case for investment, because investment in family planning is for the lifetime returns that matters. So I feel like we need to put more investment. People should, especially donors, the community of donors, governments in different countries, keep pushing for domestic resource mobilization of family planning, because now we know the pain of not having more domestic resource mobilization for different countries like Tanzania. So we keep doing that. For scientists, not being afraid, not being worried to call out when misinformation, disinformation is being put forward, even if it's by people who are powerful. Let's be honest, calm, saying that's not what evidence says. Evidence says this. And we have tools to help us, to support us. I really like these tools from the WHO, like the World Health Organization medical debate for criteria for contraception. Really simple tools available for everyone to use and promote what actually matters. And maybe lastly, I think it's time for the community to come together, to collaborate and keep innovating. And one of the opportunities, the coming International Conference of Family Planning, which will be held in Bogota, Colombia this year, which is hosted by the William Gates Institute, based at the Bloomberg School of Public Health. It's now open for abstract submissions, so encouraging people implementing different family planning programs to submit their programmatic abstract. This is one of the unique gathering to leverage and making sure that our work is moving forward and we are becoming unstoppable. And one more point, Stefan, I want to emphasize is we know where the opposition is coming from, at least growing up in Tanzania and in communities, also from my own family where I face opposition working in this field. We know where they're coming from. For many, many years, I feel like we've been disconnecting ourselves from these oppositions that are going against the work that we do, that are saying against the work that we do. But I think it's time to also push for uncomfortable conversations, but also uncomfortable partnerships with opposition forces. Because the more we say away, the more they become uninformed, but finding ways to engage with them and providing them evidence in a way that they can understand that investment in family planning has got lifetime achievements.
I guess I wonder, these are all wonderful ideas, but I do wonder if they're feasible in this current climate.
It's challenging. It's very challenging. I feel like one of the things that I think comes up today in the World Health Organization webinar on addressing misinformation, disinformation, also coming back to the role of individuals, it's really challenging. It's very difficult to implement some of these solutions, but every individual, every person can use their own power to do some good work. For instance, taking some really simple measures. When you see a misinformation online, don't retweet it, don't repost it. If possible, just report it saying it's a misinformation. When you're talking to your friend, to your colleague, keep sharing what's evident, what is fact about family planning, sexual and reproductive health, and why it matters. Keep picking up the stories of the lives we've improved within our communities, of the individuals and the lives that we've been able to touch and improve within our own communities. The more we speak it, the more we are able to engage a lot of people to be able to understand why it actually matters to work in this field. So every person as an individual, leveraging their own power, even if it's one voice, it matters as long as we're speaking the truth. If you're using Twitter, tweet something. If you're using Instagram, share something on Instagram. If you have some community groups, talk to your community groups. If you're a choir singer, talk to your choir. If you're going to church, talk to your church. Just say why it actually matters. Sometimes speak to the language they can understand, because sometimes we as people working in science and programs, we may find ourselves speaking a lot of language that we only understand among ourselves, but it's different when we communicate to different groups. When I'm communicating to religious groups, when communicating to youth groups, when I'm communicating to section gender minority individuals or people with disabilities, just different groups. It's important you keep that in mind, contextualizing our conversation in a way that everyone can understand.
Innocent Grant, thank you so much for sharing your perspective with us.
Yeah, thank you so much, Stephanie. I think this was great.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.